Risks of fully ablative CO2 laser. Is the risk of a fully ablative CO2 laser more than other types of laser, or same?
Thank you for your question. You're asking, is the risk of fully ablative CO2 laser greater than other types of lasers? And certainly it's an interesting question because there's a lot of confusion in the modern world of lasers. There's a proliferation, and there's been for a number of years, of lasers that claim similar outcomes. And of course, doctors always have their particular preference. I can certainly give you my perspective of ablative lasers and various other modalities that I've experience with. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic surgeon, and I've been in practice for over 20 years in Manhattan and Long Island. I can tell you that since the mid-90s, when the first ablative CO2 lasers arrived and I used them, I have had the opportunity to use a lot of different lasers along the way, and I can give you certainly some perspective. So to begin with, you first have to define the solution by defining the problem first. When people want to have a dramatic improvement in their skin, well, before there were lasers, there were chemical peels. There's still chemical peels, and still the gold standard on how lasers can be compared to in terms of outcomes. Chemical peels fall into basically three categories: superficial, medium, depth, and deep. Now, the golden rule is very straightforward. The deeper you go, the more dramatic and significant your results will be, but with that correlation is the deeper you go, the higher risks for complications and problems. So it's always important to have a balance. Now, there are certainly many arguments that can be made, and you will certainly get a lot of opinions when you do your research meeting with doctors about what results are best. And I think that there's no question that an ablative and relatively a deep CO2 laser will probably give you the most, quote, benefit in terms of addressing the common problems that a CO2 laser is used for, such as the treatment of lines, wrinkles, etc. But what I can tell you is that in practical terms, the difference between a laser and a chemical peel should also be defined. A chemical peel, once you apply it, it reaches a certain depth, and that's it. That's true for medium depth or a deep peel. And there's a certain physiologic response that commonly referred to as a frost for medium and deep peels that you see when you are doing these. With the laser device, you can reach those depths, but there's also an advantage of a little bit of a thermal, or a lot of a thermal energy delivery, which has its value in terms of contraction. The reality in the modern world, at least in my practice in Manhattan and Long Island, is that people don't have time. And prolonged growth, healing process is virtually unacceptable. You want to improve things, but you also want to return back to work or your normal activities within a week or within at least 2 weeks. So what I've done in my practice is I've combined modalities. I've taken the benefit of an ablative CO2 laser, but instead of a fully ablative, I use fractional CO2 laser. Now, fractional means that there are skip areas between the little dots that are made when we do a laser. And the idea is that because there's more intact skin between, you can get better healing and faster healing. Now, of course, when you repeat passes, then it becomes less fractional and more ablative. But you can also control the depth and the energy delivery. So I've always been able to customize that, and I find that that's a way to balance that as the time of recovery and the results. Sometimes you can also repeat, which is also has its own value for specific focal areas. I also combine my fractional CO2 laser with platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and if the goal is to improve your skin, well, platelet-rich plasma has the ability of stimulating blood supply and collagen. And so when you think about it, if we can do something where you're a little bit less invasive from the laser perspective and you are using a stem cell, well, I should say your body's own adult stem cell response to stimulate collagen, then you get the best of both worlds and you diminish the risk. Now, for some very deep lines, like little vertical lines around the lips, you have to be aggressive and you have to be ready for that healing process. But for most of my patients who come for facial aging related issues, I do this kind of balanced approach, and I've had a lot of high satisfaction, and people are able to get back to normal life sooner rather than later. So you have to ask yourself these questions. There are many of my colleagues, and I visit a lot of my colleagues who I know and respect, and I've watched them do facelifts and I've seen them do lasers, and they believe strongly in fully ablative CO2 laser, and they get very, very nice results. I think it comes down to who you are and what you're willing to tolerate and what your risk tolerance is, and what kind of outcome you're looking for. I think that for my practice and the type of people that I take care of, many of whom are extremely successful, busy people who don't, or are very time crunched, or have very busy personal lives and family lives, there's just not a lot of time. So we find that the strategy of smaller procedures with quicker recovery ultimately is more easy to fold into their lifestyles and still get really great results. So I hope that was helpful. I wish you the best of luck. And thank you for your question.